So here we are in the research laboratory, and today in the lab, to give you an example, some of some of the animals we have here, we have animals, mice, that we're using to find new treatments for human prostatic and breast cancer. We have mice that we're using to unlock the mysteries of Down syndrome. We have rats and mice we're using for gene therapy to cure glioblastoma multiforme. We have zebrafish that we're using to find treatments for pituitary cancer. We have pigs with coronary arterial stents used to treat cardiovascular disease. And we have dogs that have telemetry devices implanted in them to measure intraatrial and ventricular pressure to treat heart failure patients. This is Oreo. All our dogs have names. This is Red, this is Oreo, Raccoon. Raccoon's quite a character. Hi, Raccoon. How are you? How are you, good girl? How are you? Hello. Hello, good girl. Our dogs get out to exercise and socialize twice a day with their caretakers and the other dogs. We have a toy rotation program. You can see that Raccoon actually likes this particular toy quite a bit. The best thing for dogs in a research setting is actually human interaction. And all of our technicians who are very compassionate about the animals spend considerable time socializing the dog. Something that is not discussed much, recognized much, is the amount of regulation that applies to the use of animals in medical research. In my opinion, and we have human subject research here as well as animal subject research, there are actually more regulations that apply to the use of animals in medical research than they are to the use of human subjects in human research. We must have an institutional animal care and use committee, a so-called ethics committee, that actually has public representation, scientists, non-scientists, and veterinarians with special expertise in laboratory animal medicine. No work can go forward with any animals unless a sound study design with justification and great detail is reviewed and approved by the Institutional Animal Care and Use Committee. And of course that includes veterinary care, husbandry, housing, anesthesia, post-operative analgesia. Every detail of the protocol that involves the animal must be detailed excruciatingly in detail before the Institutional Animal Care and Use Committee will permit any animal to be used in biomedical research. So first we're going to spray our feet with a virucidal disinfectant to make sure we don't introduce any disease into the room, and you'll leave with very clean shoes. The majority of the rats you see in this room are the progeny of the breeding pairs we got from the National Institute of Mental Health. Some of these rats vary in age from 16 to 18 to 24 months of age, which is quite old for a rat. The average rat will live to be about 24 to 30 months old. We have to age these animals because Alzheimer's, of course, manifests itself behaviorally in human patients at a later stage in life. And so through behavioral testing of these animals, very non-invasive tests like memory tests, we can actually quantitate any cognitive dysfunction that these animals are exhibiting. We will be able to validate whether or not the rats that have the histopathologic features of Alzheimer's disease actually have the behavioral aspects of Alzheimer's disease. If we validate that, then we can work on targeting the genes in these rats that we see in human beings, hopefully through gene therapy to turn these genes off and cure Alzheimer's patients. This is one of our cardiovascular dogs that's actually had a device implanted that goes into the inner chamber, into the atrium or the ventricle, and has a device in the neck of the dog that through telemetry will allow physicians with the wave of a wand to measure intraatrial and ventricular pressure. Currently, human patients that have heart failure, to manage them, have to have cardiac catheterization, an invasive procedure which is not in the best interest of a compromised patient. This way, through telemetry, the doctor can actually assess intraatrial and ventricular pressure non-invasively and make decisions about fluid therapy, diuresis, etc., to manage the cardiovascular patient. Good girl. You're a good girl. Yes, you are. Thank you. Thank you. In this room, we have a breeding colony of mice. These mice are a model of Down syndrome, which is trisomy 21. It's extra copies of DNA on the human chromosome 21. Down syndrome is truly a syndrome. It has mental retardation, facial deformities, cardiovascular abnormalities, and we know it's because of 3 copies of a lot of genes on chromosome 21. We don't know which genes are involved. by having a mouse model of trisomy 21, and we can vary the genes that we have 3 copies of and get right down to the nitty-gritty of which gene is actually causing which genetic inherited disease in children born with Down syndrome. We've actually done MRIs on these mice, and we find with MRI, these animals have the identical cardiovascular dysfunction that the human infants that are born with Down syndrome. So we're zeroing in at the genetic level about which particular genes are responsible for which components of Down syndrome, and again, that information will help us theoretically through gene therapy to cure Down syndrome either after birth or in utero. This is Wilbur. Wilbur's our favorite farm pig. Come here, Wilbur. Good boy. These pigs are being used to test a new device to do cardiac catheterization in human coronary arterial disease patients. The current method for passing catheters into human hearts, stop nibbling, is to actually physically pass a catheter by hand down into the heart. And it's up to the skill of the surgeon to know what pressure to apply to the catheter. And unfortunately, in some instances, too much pressure is used and vessels are punctured. The new prototype device we have uses magnetized catheters and magnets and a joystick, like a video game, to actually guide the catheter with precise pressure to the exact point in the heart to actually treat the coronary arterial disease. So it's going to revolutionize the safety of coronary arterial disease surgery. And Wilbur is going to help us do that. Here we have an isolation cubicle that is a barrier to protect these very fragile mice. These mice are called nude mice. We use these for cancer research, and if you look closely, you can see little lumps and bumps underneath the skin of these mice. That's either human breast cancer or human prostate cancer. What we're doing here is testing drugs that have worked in vitro against cancerous cells to destroy them, but are innocuous to normal cells to see if they will actually kill the cancerous cells in a living, breathing organism. So this would be a preclinical situation before going to clinical trials with human subjects. This is our zebrafish colony room. We're actually using these zebrafish to actually study pituitary tumors and spinal cord abnormalities. Zebrafish are advantageous in research because they fertilize their eggs ex vivo, and the embryos develop outside of the body, unlike mice, where the embryos, of course, are developing inside the body. We can take zebrafish embryos on day 1 of conception and put them under a microscope and watch ontogeny as it develops. Also, these animals are vertebrates. They are very genetically similar to human beings. And if you can find a gene that causes an abnormality in a zebrafish, you are likely to find the corollary in a human or a dog or any other vertebrate animal. The way we study these animals is we can use them just like we would transgenic mice, where we actually introduce foreign DNA into the embryo, or we can actually expose the embryos to mutagens and cause random mutation in the genes. Then we can watch the embryo develop, and we can grow that zebrafish up, propagate it, and then we observe the phenotype and then characterize the genotype. What genetic abnormality actually predisposed this zebrafish to develop the brain tumor, the pituitary tumor, or the spinal cord abnormality? And again, the ultimate goal is through gene therapy then to be able to correct these abnormalities either in the embryonic form or even in adulthood. So these rats have been actually given rat glioblastoma multiforme. I can tell you by looking at this cage card that this rat was given its brain cancer on September 4th, 2007. This rat is a long-term survivor. It is now January, so this rat would have normally succumbed within 4 or 5 weeks. And as you can see right now, the rat is quite vigorous, acting very normal. Through gene therapy, we have evidence that we have cured these rats of glioblastoma multiforme. The next step now, as we discussed earlier, is to actually reproduce this success in a large animal, a dog, a pet companion dog, with spontaneous glioblastoma multiforme to cure those companion animals and then proceed to clinical trials and cure human patients. This is a magnetic device which we are confident will have many medical applications. The application we're looking at right now is actually using magnets. You can see the magnets here. And for cardiac catheterization purposes, we can magnetize a cardiac catheter, and instead of having a surgeon manually insert a catheter, we can place the catheter inside the blood vessel, and then by turning on the magnets and using a joystick, we can actually direct with very little pressure or the exact amount of pressure necessary the catheter to virtually any part of the heart we need to reach for cardiac catheterization, greatly reducing the morbidity and potentially mortality of cardiac catheterization procedures. We've done to date 3 pigs with great promise, with great excitement. We're just in the beginning, but we're very excited about the prospects of this new technology. There are also other applications that are being considered for this. There currently exists a camera in the form of a pill that a patient can swallow, and the camera will take digital photographs as it passes through the digestive tract, accessing places that currently are not easily accessed for diagnostic purposes. Currently, that pill is used in a passive fashion. It simply goes where it wants to naturally. By magnetizing the pill cam, is what it's called, we are hopeful that we'll be able to use these magnets to actually purposely direct the camera to any location within the digestive tract and actually get digital photographs never before seen for diagnostic purposes. We're now entering the temporary quarters for our microimaging facility, where we'll actually perform CT scans on rodents. And we have devices, this is called Maestro, this is called Xenogen, and it enables us to image the insides of animals in real time, over time. Historically, for example, when doing cancer research, where we actually administer brain cancer to a rat or mouse, one would have to, at specific time points, euthanize animals and examine the brains histopathologically to find out whether the cancer was expanding or shrinking. That's no longer necessary. That required large groups of animals. Now, with small groups of animals, we can image individual brains of animals over time to see if the tumor in that individual animal is growing or responding to treatment and shrinking. And we can precisely detect in the live animal at 1 week, 2 weeks, 3 weeks, 4 weeks, the very same animal, which is better science, and it's a refinement of the experiment using greatly reduced animal numbers, what is happening, whether or not the animal is responding to our gene therapy or not. So it's a leap forward for our ability to use animals in medical research. We're sitting in OR4 in the animal facilities at the Cedars-Sinai Medical Center. This is actually one of our cardiac catheterization units. It's representative of the entire facility. It's clean, it's well maintained. The animals that are used here, of course, are anesthetized. We are very aggressive at Cedars-Sinai with regard to pain relief, proper anesthesia, analgesia. We have compassionate people caring for the animals. 50% of the investigators here, the scientists, are practicing physicians. They spend the majority of their time caring for patients, but they also carve out important time for research using animals to improve their ability to diagnose, prevent, and treat disease. We're highly regulated. The United States Department of Agriculture makes annual inspections. We are voluntarily accredited by the Association for the Assessment and Accreditation of Laboratory Animal Care International. We have a license from the City of Los Angeles to operate this facility. We are subject to unannounced inspections. We have outside community representatives who sit on our ethics committee who review in advance of conducting any research, any proposal to use animals. We're very proud of our facilities, and I hope that anyone viewing this facility will see for themselves that what we do here is very responsible, very humane, and very likely to lead to improved health care for human and non-human animals.